Good afternoon, everyone. It's good to see you. Thanks for being here. I want to begin by thanking General Mick McGuire for his leadership during this pandemic. We are here today at Papago Park Military Reservation, an installation that is home base for both civilian and uniformed personnel working around the clock, and they have been protecting public health and safety. I've just been briefed, and I was just able to meet with some of the men and women of DEMA and the National Guard just a few minutes ago. And let me say, the efforts of what they've done have been past heroic. They've been doing this now for months and months. They've responded to the coronavirus, and since March, our National Guard has completed more than 3,600 missions. This includes more than 1,700 missions supporting food banks, more than 450 missions supporting testing sites, and more than 700 missions supporting critical supplies and resources, especially in support of our tribal neighbors, totaling more than 500,000 miles traveled. All told, our Guardsmen have worked over 166,000 hours in support of Arizonans during this pandemic. This doesn't even take into account what they've done at the border or what they did when the peaceful protests turned something other than that, and we are incredibly grateful for all that they've done. Thank you, General McGuire. In addition, I want to thank Dr. Kara Christ for her leadership at the Department of Health Services and for her incredible team at Health Services. They've done outstanding work, and Arizona is grateful for their continuous efforts along with those of all our county health officers. And I want to thank the administration as well. They've been there every time we've asked. We've been aided with support from our federal government, whether it's been on personal protective equipment, medical personnel, ventilators, resources for our tribal nations, surge testing, public health guidance. The administration has delivered for Arizona. Not only supplies, but most recently, they extended our National Guard mission with full funding at 100%. I want to also extend my thanks to President Trump and Vice President Pence and FEMA for the responsiveness and partnership. Along with that, the Coronavirus Task Force has been a partner to Dr. Kara Christ, and that includes Dr. Anthony Fauci, Dr. Deborah Birx, Admiral Giroir, who I most recently was able to talk with, along with Dr. Robert Redfield. So I want to give you an update on the latest numbers. Just a few minutes ago, we went through a briefing on all of Arizona's latest COVID-19 numbers, and our trends remain positive. Last week, our percent positivity decreased from 8% to 6%. This week so far, we remain at 6%, and we're seeing a much faster turnaround on our test results. The percentage of COVID-like illness in our hospitals has decreased to 4.1%. That's down from a high of 21% in June. Hospital capacity remains at about 20%. The number of beds in use by COVID patients continues trending downward. In fact, the number of ICU beds in use by COVID patients today is as low as it's been since late May. And today, Arizona's R0 number, the rate of reproduction, is tied for second lowest in the nation at 0.84. Again, when this number is below 1, the spread of the virus will slow, and in Arizona, the number has been below 1 for some time. So this is all good news. This is all good data, and it's good reason for people to be hopeful and optimistic about the future. At the same time, we want to remain cautious and keep doing what's working. Keep applying these steps. I'm grateful to every Arizonan for participating and doing their part. Now let's talk schools. When it comes to our schools, I want to thank all of the superintendents and school leaders who are working closely with Arizona Department of Education, Superintendent Kathy Hoffman, and DHS to prioritize our kids. I also want to recognize the countless Arizona businesses, employers, and employees who have had to make sacrifices. We know it's been incredibly difficult for so many in our state, and we want you to know that we're listening and we're continuing to do everything that we can to help. We've partnered with Local First Arizona to make small business grants available, and those grants will begin today. Small businesses can find out more about this program and these funds at localfirstaz.com/AZ Small Biz Rent. That's localfirst.com/AZ Small Biz Rent. We've also partnered with the Trump administration and FEMA to extend unemployment benefits to nearly 400,000 Arizonans. Thanks to the smart leadership and our hardworking DES employees, these dollars are already being included in payments, making our state the first in the nation to make these benefits available. We're grateful for the President for taking this action, and we urge Congress to step up and provide certainty and clarity by extending these benefits. In closing, I want to reiterate that Arizona is seeing significant progress because of the action that Arizonans are taking. They're doing the fundamentals, wearing masks, washing their hands, physically distancing, staying home when sick, and just using good old-fashioned common sense. So we can't let up. We can't let our guard down. We can't lose these gains. We are not taking a victory lap. This is not a celebration. This is a highlight on what's working and an ask that we continue doing what works. Many have asked, how and when can we open Arizona safely? How do we achieve healthy lives and a healthy economy? Well, here's how. We're going to continue to be guided by the data and the doctors. We're constantly seeking the input of our medical experts, both at the state level and the federal level, along with community leaders to determine the responsible way to reopen our businesses so that everyone can resume their lives safely, sensibly, and responsibly. Returning our kids to the classroom, reuniting with our loved ones, all of these depend on continued responsible behavior that you have demonstrated so well for so long. So I urge everyone to stay the course, stay physically distanced, stay smart and healthy, and continue to mask up. And with that, we'll take some questions.
Yeah, Governor, now that the numbers are trending in a positive direction, it looks like a number of counties should be hitting those benchmarks where bars, gyms could start reopening. What is the plan in place to ensure that these establishments, these types of businesses, will be following the social distancing guidelines out there so we don't have a repeat of what happened in June after that Memorial Day?
Yeah, so we have put guidance out there for schools, for gyms, for bars that will be transitioning into restaurants. There's very specific guidance. We're going to be working with local enforcement, the Department of Health Services, and of course the levers that we have in state government to make certain that guidelines are being followed, enforced, and we've been pretty good at holding folks accountable, and that's going to continue. But specifically, that's going to continue to be the posture.
What is specifically, though? How do you go about enforcing this? You're saying you're going to work with local governments, but how are you going to do this?
When someone breaks a guideline, they're going to feel consequences.
From who?
Sometimes it will be the state, whether it's health services or Department of Liquor, and there's local enforcement as well.
Sure. Thank you, Governor. I know you like me down on my knees when I'm talking with you here. A couple of things occurred today. I know, because I forwarded it to your press aide, Attorney General Brnovich continues to send you letters saying he now has the drugs for executions. You have seemed reticent to engage in executions. What are you holding for? The Attorney General says, I've got a source of the drugs. We've got dozens of people on death row. It all depends on your Department of Corrections ordering them. What's the holdup?
This is the first letter that I've received saying that there's an actual solution to what was a lack of product that's there. This is the first letter, and it was just received. It was breaking news as I walked in to the press conference. So let me get the details, find out what the situation is, where the sourcing is, et cetera, and then I'll have a response for you. I haven't been reticent. There's been no opportunity. Okay,
then this question could be, I don't know what for you or for Dr. Christ. When you guys announced that splash parks could be open attached to resorts, but not freestanding, the logic, the explanation was, well, the resorts are only offering these splash parks to their guests. Well, I know that your director now knows that that's not the case, that you can go to any of these resorts and pay a fee. So tell me, how do you justify the difference between how you're treating resorts and places like Mesa's Golfland Splash Park?
That was seen as a loophole. I am going to turn it over to Dr. Christ so she can talk about how the guidance will work.
Okay.
Thanks, Howie. So when we found out that there were hotels that were operating water parks that were allowing the general public to attend, we have reached out and started doing an investigation to see how they are managing crowds, if they are bringing in outside of like their reserved guests in there, and we'll be working with them to bring them into compliance.
So bring them into compliance means they will not be able to have outside guests?
So what they would have to do is they would have to limit it either to the guests, they would have to work on a reservation system, something like that, yes.
Then why can't Mesa Splashland work on the same system? They're willing to limit their number of guests. They're willing to work on a reservation system. So again, tell me why you've singled them out.
Oh, they're absolutely welcome to provide an application saying how they'll safely reopen before the moderate. They can do, absolutely, they can do that.
Thank you, Governor. Billy Harfosh, iHeartRadio. Lots of good news, cases dropping, good numbers we're seeing. You know, you talk a lot about theaters, bars, gyms. What about just normal businesses? I mean, a lot of business owners don't know if they should recommend their employees to come back into an office-like setting. Hundreds of thousands of Arizonans are working from home still. Are you ready to recommend to managers, business owners to say, yeah, get your employees back in the office?
So I think it's a very fair question, Billy. We're still of the posture that we want to see this virus continue to slow. So when there's less activity, there's less transmission of COVID-19. We've given flexibility to local business owners, employers, and employees, and I think they've provided a lot of flexibilities out there. We've certainly seen, and I know many employers have seen, that their employees can be just as productive at home as they were inside the office. But we're going to, at this time, be from the posture of you're safer at home if you don't have anywhere else to go, if you can work at home. But that ultimate decision, that ultimate flexibility at this time is left to the employer. But we do ask this idea of socially and physically distancing, the wearing a mask, all those fundamentals. That's what's going to make the difference. It's also going to depend on what the work is. Are you talking about people in cubes that are naturally physically distanced? Are they in some kind of bullpen where they're very close to each other? That would be something we'd want to discourage, or find a way that they could follow the public health guidelines. That's what we want people to do.
Thank you.
Afternoon, Governor.
Hi, Jeremy.
Today is the deadline for people to apply for the Arizona Independent Redistricting Commission, and I'd like to know what you have done to prepare for this, not just as the governor, but as kind of the effective leader of the Republican establishment in Arizona. For example, have you directed anyone to recruit applicants? Are you making any other preparations to try and influence the redistricting process?
I know that there have been people that have been working to find folks that are willing to do this. There's all kinds of stage gates for someone to be eligible for the IRC, but it's not been something I've been personally focused on.
So you haven't directed anyone to take any actions on your behalf? Or
No.
Okay, and on one other issue, there are about 100 bar owners have signed on to this lawsuit from the fitness centers. A lot of people are planning to rally at the Capitol today. They believe that a lot of these restrictions are being applied very unfairly, that some bars aren't allowed to open, but bars in other places are. Do you believe that these restrictions are being applied in kind of an inconsistent manner? And are you planning on doing anything to rectify this?
Well, we want to have a consistent process. We want to apply that in a consistent manner, but I think anybody that's frequented some of these places knows how different each situation is. That's why we've left it to the Department of Health Services to review these plans, to ask the questions, and to make the best possible decisions. We've put out the guidance on how to do this, what minimal and maximum looks like, as well as moderate. But if people will work with our team, work with the Department of Health Services, I'm confident if they're willing to make some changes, we can find a way to resolution.
Hi, Governor. Hi, Dr. Christ, General. Governor, the state is clearly divided on a number of issues. Parents and teachers are fighting over the issue of going back to school. Teachers calling out sick. Bar owners frustrated with the system of who gets to open, who doesn't. Issues with data and not all of the data being included for key metrics. As the state's chief executive, do you have a message to try and unify all these groups?
Well, I want to acknowledge that I think it's accurate that people are very divided on a number of fronts right now. What we would try to do from a unifying message is that we're going to follow the science here. I mean, we're going to focus on health and safety. And as I've said several times before, when you talk about schools reopening, there are some parents that want, as soon as it's possible, to get their children back into a classroom. And there are parents that we all know that are not putting their child back in a classroom. So what we've tried to do is to provide options for both these parents, for both these families. We've also have some teachers that are in a vulnerable category or have an underlying health condition, and we will need online learning in this hybrid model. So we're trying to, in a very difficult and challenging time for our state and our country, to provide the smartest plan of action that we can. Now, when you talk about the data, our data by independent sources that work with Johns Hopkins and the New York Times and the Wall Street Journal rate Arizona's data at A+. If you've got a specific question around the data, you can ask it. But our data is put out there every morning. I think it's live at 9 a.m. And what I'm here today talking to you about is the strength of that data. And that data puts us in a different position today than we were 4 weeks ago. What we don't want to do is let our guard down on it because we don't know what's in the future. The virus is unpredictable, and we do have flu season ahead of us, even though on days like today, it doesn't quite feel like it.
Governor, can you make a commitment to Arizonans to be more present, not campaigning with President Trump, to guide each of these issues instead of local jurisdictions trying to maneuver where to go and what to do?
I'm focused 100% on my day job every day. What we want to do is, like I said, continue to be data-driven, working with the medical health professionals, both at the state and federal level, with the focus of health and safety, while at the same time realizing it's a big state and the situation is different in different parts of the state. So where possible, there will be local control and necessary and appropriate individual freedoms.
But what is your message of unity for the state? And what is your message of unity?
My message for unity is let's wear a mask, let's wash our hands, and let's be physically distant.
But my last part of that was, will you reach out to any teacher groups to try and unify the state teachers, or will you continue your practice of not dealing with the AEA?
I work with teachers, I work with superintendents, I work with principals. We'll continue to do that.
Hi, Governor. On data, results that are not reported electronically are not necessarily entered into and reflected in the positivity rate from the state. So when are we going to have a system that fully takes those reports into account?
Dr. Christ?
So when you are looking at utilizing data, you want accurate data, you want data that is consistent and complete. We know that with electronic lab reporting that we get all of the negatives and all of the positives, which is why we, along with several other states, are using ELR reports only. We did look at what the totality since July 19th was of paper reported reports. It was about 11,000, or about 6% of the total reports that we would have received during that time. So the majority of our labs are coming in through ELR. It has been the consistent method that we have used to determine percent positivity, and it's the method that we'll continue to use.
Do you feel like it's still worthwhile, though, than to use positivity benchmarks in reopening guidelines, things like that? And how are you confident that that's not skewing what we're talking about when we're talking about a matter of percentage points here?
Since we're looking at such a large population, this is a statistically significant proportion of the labs. And so we feel very confident that that data is accurate, that we are able to make decisions off of it. I would feel much more comfortable with that data than data that was coming in on faxes.
Yes, hi, Governor. With kids going back to school, some virtually, some going in person, how can you support being back in the classroom when not all benchmarks are being met by the counties?
I want people to follow the benchmarks, to follow the guidance. Like I said, when you look at the details on it, 2 consecutive weeks with a 12-day lag, we're headed in the right direction. I think I saw breaking news as I was heading in here that 4 counties qualify today. Several counties are on the cusp of a week away. So again, what we're doing is being as safe and responsible as we can, and also providing flexibilities to parents depending on what the decisions are. Where the situation warrants, there's going to be a local decision. So we've provided that flexibility in the guidance.
But do you think all benchmarks need to be met for districts to consider going back in the classroom? These are benchmarks that are put out by the Department of Health.
They're guidelines, and I think part of it is trends are important, and also situations of dealing with teachers and parents. So we put this together with input from the public school superintendents from around the states, principals, and stakeholder groups. So we think it's a good plan.
So as you probably know, ASU and other universities are reopening classes in person. What are some of the concerns that you have? We've seen other universities opening up in other states where a number of students have gathered in large parties. And do you have any concerns that something like that might happen here?
Yes, I do have concerns. I mean, part of what we're doing, whether it's on K-12 education or our universities, is to have a smarter plan of action on how we deal with this. And I do think the options that our universities have put out there, the first person I heard talk about this plan was Dr. Crow on a podcast on all the different modalities on which a student could access the classroom, from the traditional model of being inside the classroom to those that watch it on a screen to those that have a hybrid approach. We've tried to use that kind of learning, and ASU's been doing this for years, to how can we do this safely and successfully at the K-12 level. We've also seen what's happened around the country, and we're trying to work with our young people. It's certainly a lot easier with grade school children and even high school children. College kids do like to socialize and do like to get together. I do think the universities, both Dr. Crow, Dr. Robbins, and Dr. Chang, are over-communicating with the people that are on campus. And there are options. They're not optimal options, but I give them a lot of credit to try to have the safest, most successful, high-value educational experience this year, and we want to do it in a methodical and incremental way.
But if there is an outbreak, are you recommending that schools close, that they go back to online learning instead of in-person classes, or what are you recommending?
Well, what we want to do is avoid that. if possible, these different scenarios are contemplated in the school reopening plan, and it really depends on the situation.
And then my last question on the flu season, it's coming up. What's the state and the state health department as well doing to prepare for that? We're seeing our numbers improve for COVID, but with the flu season coming up, I imagine it's going to overwhelm the hospitals again.
Well, it's a good question. I'm going to let Dr. Chris talk a little bit about the hospital capacity. And like I said, it doesn't feel like flu season's coming up, but you're right. It is coming up. Over 50% of adults in Arizona already get the flu vaccine. Same for our young people. We're going to be using our CARES dollars here in Arizona, along with other federal assistance, and I talked to Admiral Girar about this last week. We want everyone to get a flu shot. Everyone that's willing to get a flu shot, and we don't want anything to get in the way of your access to that. And Dr. Chris can talk about not only what happens during flu season, but what it could mean the more Arizonans that do take advantage of this flu vaccine. We won't have those details for you today because we're working on the resources and capacity. Right now, we're more focused on COVID-19 and that testing, but the flu vaccine does exist. There's going to be extra supply for the state of Arizona. And will you touch a little bit on that, Doctor?
That has been one of our concerns, is having COVID on top of flu. So we know that Arizona's flu season goes about October to May, with our hardest months usually being January to March. So we are going to be launching a public service announcement campaign encouraging everyone to get vaccinated. While it's not 100% effective, it does significantly reduce hospitalization and complications and bad outcomes. So we want to make sure everybody knows to do that. We're also going to be piloting to increase vaccine in like where you can go get your shots within the community, because we want to make it as barrier-free and as accessible as possible. And we continue to work with our hospitals and to get that data so that we know where their capacity is, and we will maintain that through the Arizona Surge Line, the PACT dashboard, and all of those things so that we can help keep the health of our healthcare system good.
Thank you. So myself and plenty of other reporters are having a lot of problems asking or not getting our questions answered by the Department of Economic Security and Corrections. And I'm curious why neither director has been at any of these press briefings, and if you're willing to commit to bringing one or both of them in the future.
Well, first I want to say thank you to Michael Weishart and the excellent job that he's doing at the Department of Economic Security. It's been an incredibly challenging time at Economic Security, and David Shin, I think I can still call him our new director at the Department of Corrections, Rehabilitation and Reentries, had incredible challenges, not only that he inherited, but that COVID-19 bring, and that's a possibility that they'll be participating. It's a possibility. We've discussed having briefings actually at DES.
But why haven't they been to any that you've held throughout this entire pandemic? Neither director from, I know there was several directors for DES throughout the pandemic, but Director Shin has not been to any. He's barely given any media attention except for KTAR, and people have questions for him, and we're not getting it from his comms team.
Keep asking. We've erred on the side of Department of Health Services. That's really been the lead agency here. Department of Emergency Management has been in a support role across the. Can I finish the answer? Across the board, along with the National Guard, doing everything from surge testing to going up to the tribal nations. So we've had Director Silbert here from the Department of Public Safety, but it's really been what's the topical issue of the day and the situation.
I mean, corrections has been an issue for months, and still has not answered any of anybody's questions.
Well, why don't you work with the comms team, and we'll get you the answers.
Thank you, Governor. I have two questions, and they're likely directed at Dr. Christ. The first one is, we have lots of students going back to the universities right now. Are U of A, ASU, and NAU, are they reporting their test results of the students and faculty to the state?
Yes, so any positive test is reportable, whether it's through the lab that they're using or the healthcare provider that is ordering that lab test. So they will be reporting that, but we do work very closely with our universities.
So they are reporting those numbers?
Yes.
Okay. So my second question then is, last night we reported that more health clubs, gyms, are getting their applications denied than have had them approved. Is there something that they are consistently doing wrong in trying to get their facilities ready?
So what we're seeing on most applications is that they're saying that they will meet the requirements that are required when we are in the moderate phase. So they'll say we'll require masks, we'll keep the occupancy at 25%, we will follow the requirements, and we agree to do that. What we're looking for right now, because we have higher transmission in the community, is we want them to establish above and beyond that more reduced capacity. Are they going to do a reservation-only system? How are they going to limit the people? How are they going to make sure that people aren't coming into the facility sick? If we've got questions, we've been reaching out to providers because we do want to assist people to open up safely and while keeping the public health in mind.
And then finally, just real quickly here, we know that schools are doing everything they can to prevent outbreaks. We know that when some of them have had outbreaks and they have plans to shut down, is there enough guidance, and have you seen plans that are adequate enough for how schools should deal when there is an outbreak in a classroom? Because we know this is going to happen.
So we strongly encourage that the schools reach out to their local health departments. So making sure that they're implementing the mitigation measures that are in the roadmap and that they are supposed to post on their website for their local education agency. But we would also recommend that they work with the local Department of Health so that they can assist with contact tracing, with quick testing, with recommendations, and also technical assistance to prevent further spread.
Hi, Governor.
Hello, Courtney.
Yesterday, I found out about 90,000 claims that have been held up are going to be paid out, only after my photographer randomly saw it on Twitter. The comms team that you just talked about puts out bits and pieces of information if you know to ask for it. There are Facebook support groups for people to try and get a nugget or a kernel of information about DES from the lucky few who are actually able to get through. That is how poorly DES communicates with your constituents. How can and will you fix that?
Well, first I want to say, again, DES has gone from a position where there were 17,000 people in the state of Arizona to where at our maximum there's been over $1.1 million in claims. There's been over $8.5 billion paid out in benefits direct to Arizonans from the Department of Economic Security. They're averaging 7,598 phone calls a week inside the agencies, some weeks in excess of 10,000. Now, this is no excuse. Their focus has been on getting dollars to Arizonans. And in the midst of all this, there's been national scam artists trying to defraud our welfare systems across the country, including Arizona. So what we've wanted to do is make certain that the dollars are available, both Arizona dollars and federal dollars, to go to people that have been displaced and not to these criminals that are trying to steal from the federal and state fisc. And they've resolved that, and that's part of the reason with the 90,000 claims that were being held up. That has been their priority. I know there's frustration in the press corps because your questions have not been answered. I know Patrick's been working double duty to get those answers, but at DES, their focus has been 100% on getting the dollars to Arizonans, not to returning reporters' calls.
I'm going to tell you, the frustration is not just mine. There are hundreds of thousands of Arizonans. I get hundreds of emails every single day, and it's not just about fraud. It is about anything you can imagine. And I would bet that if someone were here from DES to answer these questions that I'm sure all of us are getting, that would be eliminated.
We can make that happen. We
Can
can make
we
that.
please?
We can make that happen. The thing I want to say though, just because your mic is live and so is mine, there's over we're a state of 7 million people.
I
Okay?
think people understand
They're
that,
a state of
but
7 million. Wait,
people
can
are
I finish? Can I finish the
homeless
answer?
at this point,
Yeah.
waiting on this money.
Well, and the 1.1 million people that have been displaced have had $8.5 billion
Not all
distributed. Yes,
Not all of them.
$8.5 billion has been distributed, and Arizona was the first state in the nation after the pause in unemployment benefits to be eligible, and DES has those dollars flowing. They're not perfect, but they're, all things considered, they're working and doing their best in incredibly challenging circumstances, and they can do better, and we can get your questions answered.
Thank you.
Thanks, Governor. I just wondered if you had any thoughts on the arrest of Steve Bannon. Thanks.
You got to follow the law, and if you don't, there are consequences. Bob, is that you sneaking up?
I have a follow-up on the flu. Governor Bob Christie with the AP. I have a follow-up on the CARES Act for flu shots. Are you suggesting that the state's going to provide free flu shots for a large portion of the population that cannot afford it, aren't insured, those type of things?
What I'm suggesting is that we want everybody that wants a flu shot to get a flu shot. So we're, like I said last week, when Howie said there were no numbers to crunch, there's always numbers to crunch. So we're crunching the numbers. We think one of the best things we can do to help around public safety and responsibility and sensible policy going forward is, of course, we don't want anyone to catch COVID that can avoid catching it. And it's the same philosophy with the flu. So it was a very good question. It was a little bit ahead of its time because we've been talking internally about this for several weeks, but I don't have all the details. But I also didn't want to say this isn't something we've thought about. It's something that Dr. Christ is leading on. It's something that part of the reason that I've worked so closely with the federal government is part of this is Arizona dollars spend once. The feds have been very helpful in terms of the specific asks that we've made. Most recently was to extend the National Guard at 100%. But I want to find a way that any Arizonan that wants to get a flu shot can get one. Details to follow. Right. So let me close with, again, saying our data is headed in the right direction. And that is a tribute to Arizonans making safe, sensible, responsible decisions. I'm grateful. It's not a time to celebrate. I know everyone wants to get back to normal or get back to as normal a way of life as possible. We want to do it putting health and safety at the peak of our decision making. So let's keep our guard up. Let's stay vigilant. Let's continue to wear our masks, wash our hands, physically distance, and stay home when you're sick. Thanks, and more to follow. We'll see you soon. Be safe out there.